Taoiseach. Along with the triple crisis of the cost of living, energy and housing, there's another crisis that demands urgent government action, and that's the crisis in our health service, specifically in our EDs. Yesterday, the President of the Irish Association of Emergency Medicine, Dr. Fergal Hickey, said that this winter was likely to be a hell on earth. A hell on earth. That was for patients as well as staff, and that we're facing what could be an Armageddon-type situation. We know there have been 40,000 breaches of waiting times this year. That's 40,000 patients waiting in excess of 24 hours. Last Wednesday, there were 596 patients without a bed, including 20 children. Dr. Hickey went on to say that emergency departments have become warehouses for admitted patients, and that this is a 365-day-a-year problem. The INMO described the situation as an entirely predictable surge and called for a laser focus on recruitment and retention. Staff vacancies pose arguably the greatest threat to our health service. There are almost 900 consultant vacancies and no sense of urgency from your government, Taoiseach, about agreeing a new consultant contract. Our NCHDs are leaving Ireland in their droves due to serious issues of excessive working hours, not even getting paid for this overtime, and many report burnout, lack of career progression and bullying. Nursing is equally under pressure to retain staff. Faced with the pressures on our health services, the cost of living and the prohibitive cost of housing, no wonder so many go away to work abroad in health services that actually function properly and provide care for patients who need it. In addition, of course, and importantly, our acute bed capacity is 2.8 per 1,000 population, while the OECD average is 4.3. Ireland has the lowest number of hospital beds in the EU. Over 300 of the beds which were to be delivered by the end of last year have yet to materialise. And Taoiseach, incredibly, yesterday's meeting of the Emergency Department Task Force was the first since January. So Taoiseach, my questions for you are: how will you prevent what is likely to be an Armageddon in our EDs when COVID and the flu put even more pressure on our emergency departments this winter? Secondly, will you announce a fully funded winter plan along with the budget next week? Two more. What will you do about the recruitment and retention crisis in our health service, which needs urgent attention? And what action will you take to urgently increase the number of beds to a safe level?
Thank you very much, Taoiseach.
Yeah, but first of all, I would say to the Deputy that the health system has gone through very tough times during COVID-19, as we all realise. And I've long articulated my admiration for all those who worked on the front line during the various stages of COVID. We saw on our television screens the enormous challenges and pressures that COVID put on our health system. And our health system proved itself resilient in the face of an unprecedented pandemic. And over the last number of years since the pandemic, we have increased dramatically the level of funding to our public health service. And we have also increased capacity very, very significantly. About 900 acute beds now have been provided, about 340 community beds provided. ICU beds gone up from about 255 to about 306, which is a significant increase in terms of intensive care beds. In the first instance, what will be critical, and it will be a very challenging winter because we've watched what's happened in the aftermath of COVID in places like Australia and New Zealand, where we didn't have the flu for the last 2 years. Essentially, COVID was dominant. We now have the real prospect of a flu, widespread spreading of flu and COVID-19 for that winter period. So vaccination actually is the first line of defence in terms of people's lives and in terms of people's health. And I would urge people to get vaccinated, particularly those who are recommended to get vaccination, both the COVID booster doses and the flu vaccine, which I think in early October is commencing, the flu vaccine campaign. We've also increased home support hours by about 20.5 million. That were delivered. 20.5 million home hours were delivered in 2021. That was 2.9 million more than 2020, 17% increase. And again, a higher target for this year. But again, there are issues in terms of home care teams having expanded so quickly and so fast and so in such a significant way. That created a strain and pressure on home care teams as well. There will be a winter plan. It will be announced funding-wise as well in tandem with the budget. The HSE task force is meeting on a daily basis to prepare for winter. It will be a very, very challenging winter. I would point out to you that about overall staffing numbers have increased by 15,000 in the last 2 years. That's the largest ever on record since the HSE was established. And that includes 4,500 nurses and midwives, 2,300 health and social care professionals, and 1,400 doctors and dentists. So the health service is recruiting at a level it never has before. That does not mean that there still aren't challenges in recruitment of key professionals. There are, but everything will be done to make sure that we support the health service in terms of the coming winter.
I'm not sure what everything will be done means, Taoiseach. I asked you for specifics.
I gave you specifics.
Do you not believe what the President of the Emergency Medicine Association is saying? He's saying we're facing a potential Armageddon in our health service this winter, in EDs in particular. There are almost 900 consultant vacancies. What are you doing about that to finalise the negotiations on the consultant contract? What are you doing, and the Minister has been well warned about this, about the huge loss of NCHDs because of the dysfunction in the health service, because of burnout, because they're not being paid, because there's no career progression? And what are you doing to hold on to nurses and other key health professionals? This is all coming together. There's virtually no workforce planning going on within the health service at the moment. We have no idea how we're going to hold on to people and how we're going to ensure an adequate number of training places. And there's a huge shortage of placements within the health service. The HSE stopped those a number of years ago. So I'm looking for specifics from you, Taoiseach. What exactly are you going to do to avoid what is being predicted will be a hell on earth this winter?
Yeah, I gave you specifics on beds, I gave you specifics on ICU, I gave you specifics on home care hours, I gave you specifics on a whole range of issues
what you will do.
In terms of preparing and upgrading the health service and so forth. College places have been expanded for all of the professions over the last 2 years. Yes, they have. You can't just nod your head, and there have been increases. And in terms of career progression and so on. I would make, as I say, the winter preparedness plan has adopted a bottom-up approach. It's gone to every group, every hospital group, has sought local plans. Sanction has been given to hire emergency consultants if they so wish. In other words, the plans that have come from the various hospital groups, flexibility will be applied in terms of sanctioning teams that they want to hire. We're implementing measures, as you know, to help the flow. First of all, by avoiding people getting into emergency departments, providing GPs with greater access to diagnostic tests. That has been very significant in a range of areas, developing community integration teams, developing integrated care teams for older people. The enhanced community care has been very effectively rolled out. And all of that is preventing people from going into ED in the first place. The other key issue is flow of patients through the hospital and then subsequent discharge.
Time is up.
That is key to keeping the emergency departments freer, if you like, to take people in.